As parents, we all know that moment. Our child suddenly covers their ears in a noisy restaurant. They have a major meltdown at the grocery store where you leave the groceries in the cart because the kid's going so crazy. Or they become overwhelmed with the tags on their clothing. Now, some might dismiss this behavior or just suggest that they're going to grow out of it, which they may. But the actual reaction they're having, it's a sign of something much deeper, and it shows that your child's nervous system is dysregulated. We're going to focus today on this understanding of a neurological basis of what overstimulation is and how we can actually unlock answers by searching for the actual cause. And we're going to find solutions for your child that extend past just the sensory-based challenges. This video is created for parents like yourself whose child is struggling with sensory overload or overstimulation. They may have been diagnosed with a condition like autism, ADHD, or a sensory processing disturbance. And a lot of them are showing these signs of being easily overwhelmed by a very basic environment. So let's focus on this overstimulation from a neurological perspective and teach you how we can actually reveal these sequential factors, this perfect storm of events that are really impacting your child's nervous system development and how their sensory processing is being interacted in their body. And I'm going to teach you today how neurologically focused chiropractic care not only addresses the root cause of these challenges, but actually allows the body to start healing itself, which is the way God designed our bodies to actually function. Now, the CDC says that up to 40% of school-aged children today suffer from at least one chronic health condition. I'm going to repeat that. 40% of children today. That's insane to see that many children are having challenges with their health that are chronic. These aren't acute issues, not an ear infection, not a common cold. This is a chronic condition. And sensory processing challenges are becoming so common. They're increasing every single year. We're not looking at the cause of this. We're not looking at any sort of attribute to it. And that's why we're doing these videos, is to teach you a different perspective, because these traditional approaches oftentimes focus on avoiding triggers or managing symptoms. They're never focusing on the solutions of the underlying imbalance neurologically that creates this sensory overload. Now, the medical system, they tend to view these challenges through separate diagnostic lenses: autism, ADHD, anxiety, when actually they're often interconnected in a common thread, and that's the nervous system dysregulation. So instead of focusing on more labels, let's dive into what this overstimulation actually is from a neurological perspective. Now, overstimulation occurs when the brain actually receives more sensory input than it can effectively process. So it's a processing situation, an internal imbalance in how the brain and body are communicating together. And it's like a traffic jam, but neurologically, and it's affecting the nervous system. Way too many signals trying to get through at once. The body just can't handle it, and that's when that child goes into a meltdown or a tantrum. It's not behavioral in most situations. This is a situation where your child's brain and nervous system aren't synchronizing together. It's not functioning and processing the environment in the way that it should. The autonomic nervous system are part of the nervous system that automates things that you don't consciously have to think about. Now, there's two key branches. There's the sympathetic nervous system, which is fight or flight. And then there's the parasympathetic nervous system, which is rest, digest, and regulate. And the nervous system's designed like a vehicle: gas pedal, brake pedal, interchangeable when you need them. A lot of kids, their gas pedal's stuck down, the brake pedal just simply doesn't work. And the cause of this is neurological imbalances. So subluxation patterns occur, this neurological stress inside the spine and nervous system, when a child gets stuck in sympathetic dominance. And then there's this cascade of events that unfolds, which are like difficulty sleeping, digestive issues, emotional dysregulation, just to name a few. And what happens is this imbalance in the communication affects every other organ system in the body, and then the body just doesn't actually function the way that it's designed. And this overstimulation starts from these sequence of events that starts prior to even conception. We look at mom's health prior to conception. A lot of moms have health challenges prior to getting pregnant, and that affects the development in utero. Then we talk about prenatal stress and how it can impact the fetal brain development and sensory processing internally. So the thing is that When we're looking at mom's communication to baby, the brain and the spinal cord, the autonomic nervous system, are actually developed within 10 weeks in utero, before you're even celebrating conception. So if there's a stressful environment, now mom's nervous system literally trains baby's nervous system on what is balanced. And if mom's out of balance, out of synchronized with her environment, which happens far too often, then it starts to train the baby's nervous system to really mirror image these factors. And then we add on these other stressors, because pregnancy is crazy stressful right now. It's not this relaxing, educating, empowering environment. So for a lot of moms, they're going to a hospital, it's getting more stressful, more interventions, and it causes this cascade of events, and then it leads to other interventions and things that deviate from normal delivery processes, where now C-sections or forceps or vacuum extractions are incorporated, not to mention the epidural and Pitocin that are involved in so many pregnancies in this day and age. And that then creates this physical and chemical barrier where it creates stress on the nervous system development as well. And then we see these kids that come out very dysregulated from the very beginning. These kids will have challenges with digestion, with breastfeeding, with actual neurological development in the future. And then these childhood stressors and environmental factors further impact the nervous system development as a whole. These kids have more ear infections, the higher rate of colic and other challenges, digestive imbalances. All of these things show that the nervous system are unregulated. Now, some of the softer signs of overstimulation physically can be headaches, nausea, and fatigue. So watch out for kids like that. It's not normal for a kid to have a headache or to be sick and be nauseous and fatigued or lethargic. Those are physical symptoms that the sympathetic nervous system is exhausting the environment. Then emotional signs are the irritability, the anxiety, or the emotional outbursts. And anxiety is something that is not a common expression for a child, because anxiety really, it's this cascade of events where the cardiovascular system's getting ramped up, the respiratory system starts to kick in and start to have that hyperventilation. The body is stuck in this sympathetic dominance, and it affects all these other organ systems as it's designed to do. But the problem is that our society is so sympathetic dominant in every way, from screen time to our schedules to our nutrition. Everything stimulates this sympathetic nervous system, and then the brake pedal portion just isn't quite working. It's like tapping the brakes, but the brakes aren't working. And then we see behavioral challenges where these kids are having issues with focus. They're having meltdowns, and you have to realize a meltdown is very different than a tantrum. A meltdown is when this child cannot snap out of it. You can't reason with them. You can't barter with them. You can't say, hey, Johnny, if you stop crying, I'll give you a sucker. No. A meltdown, that kid's so far gone off, you have to back up and just say, okay, do your thing and I'll be here when you're done. That is a sequence of neurological events that shows that the child is incapable of moving out of that sympathetic dominance. And when they get stuck in this all too regularly, it starts to look like behavioral challenges, but really it's just their nervous system so dysregulated that it starts to cause issues in normal basic performances. So if your child has these issues, you can either wait and watch and observe and deal with each one, differently. But the problem is that the problem in and of itself, the neurological imbalance, continues to build because nobody is getting to the root cause of why that is actually happening. Now, when we talk about opportunities, and we're not looking for medication, we're not looking for therapy-based approaches, or maybe those things haven't worked if you've already tried them, now we start to look at neurologically focused chiropractic care, because it is the only profession that specifically works with the nervous system. See, in chiropractic, we do not focus on individual management of symptoms. I don't have an adjustment for anxiety, or an adjustment for focus and attentiveness, or an adjustment for speech. What we do is work with regulating and balancing this nervous system to allow the body to function properly. And that's so different than the symptom-based care that doctors are providing in most medical environments. So we have to first understand what this opportunity actually entails. And really it starts with testing. And our tests aren't used for diagnostic criteria. I'm not interested in a label. I'm interested in understanding where subluxation and nervous system dysfunction are occurring within that child's nervous system. We focus on very precise adjustments, very specific, and we want to release the stuck patterns within the sympathetic nervous system The spine houses those nerves. If the spine's out of alignment, if the nervous system's stressed out, it's going to cause an imbalance in regulation. And I would love for that nervous system for stimulation and activation of the parasympathetic system. And that helps regulation, it helps rest, it helps that body just be more synchronized and balanced. And we address the root cause. And instead of just managing symptoms, meaning that we use adjustments to minimize symptoms like medications or therapies do, we are correcting the imbalance and allowing your child's body to actually heal itself. It's the way God designed the body. So if you as a parent are tired of watching your child struggle and they're having sensory overload and you're ready to address the root cause of their challenges, instead of just getting another diagnosis or another medication or another IEP certification for your child, let's focus on neurologically focused chiropractic care. Because here at Maximize Chiropractic, we use state-of-the-art technology. These Insight neurological scans will identify exactly where in your child's nervous system they need support. We create customized care plans then that will target their specific needs and your specific goals as a parent. The first step towards real long-lasting change first has to be measuring how your child's nervous system is actually regulating and how it adapts to stress. And then we focus on the neurologically focused scans here at the office to measure that information, quantify it, objectify it, make sure that we see exactly where it's at. Now the scans are super non-invasive. They don't hurt, they're gentle, we're not restricting children, they're doing it right with the parent next to them, or even with the parent holding the child in their lap. And then we can understand why their sensory system is not adapting to the environment around them. And we can actually understand how to help calm it down and how to get the body regulated. So if you want more information, check out the link below. Comment and we'll send you more information. We'll give you information, give you education, support your journey, and just answer any questions. And we can really help that child who's overwhelmed by just working with their nervous system to help it get balanced. Have a blessed day.